Audience of two for the Pseudomonas presentation by Stephanie Morris. Pseudomonas aeruginosa. What is Pseudomonas aeruginosa? It's a pathogenic bacterium responsible for a large number of nosocomial infections. Characteristics are it's gram-negative, rod-shaped, has a single-polar flagella, and has pili. It's obligate aerobe, has a fruity odor, and blue-green discharge. Negative gram stain. This determines the cell wall of the bacterium. It stains pink. It has a thin layer of peptidoglycan. When it lyses, it releases endotoxins that cause fever, diarrhea, and shock. Difference between gram-positive and gram-negative is an example. Gram-positive stains purple and gram-negative stains pink. Difference in the cell walls, gram-positive and gram-negative. Gram-positive has a thick layer of peptidoglycan, and the negative has a very thin. Various bacterial shapes. Ours, Pseudomonas, is bacillus. Here's a picture of the pili and the flagella. Help to make it mobile and adhere. It's an obligate aerobe, means that it needs oxygen for cellular respiration to generate energy. And here are different examples of the other aerobic, anaerobic criteria. The pyocyanin also means blue pus. As you can see, it gives off the bluish green tint. Where can it be found? It's all in the environment: soil, water, on plants, in the respiratory and digestive tract. In the hospital, it's found on respiratory ventilators, sinks, and showers. It has many virulent factors and releasing toxins. Endotoxin is released when the cell is lysed. Here you see it getting eaten by a macrophage, releasing and causing fever in the body. Exotoxins, flagella, pili, and enzymes. Exotoxins cause tissue necrosis. Flagella and pili, as we talked about earlier, and enzymes, toxic to the cells, cause bacterium and sepsis as well. Have the ability to get into the blood supply. Biofilm, it forms communities of bacteria. It's protected by a sticky layer, and that layer that protects the biofilm has to be gone through in order to kill the bacteria. Biofilms are common in cystic fibrosis patients because they produce a large amount of thick mucus in the airway, and it makes it really hard to eradicate an infection in cystic fibrosis patients once they get one. Biofilms can form on foreign objects within the body, such as artificial airways. Here's a tracheostomy, and once that ventilator, if they're on mechanical ventilation, it'll push the bacteria down further into their lungs. Here's a biofilm on a urinary catheter. So also can be grow on pacemakers. Type 3 secretion system is found in some strains of Pseudomonas. Not all of them have it. Strains that do have it are the most virulent. This injects the exotoxin straight into the cell and helps it bypass antibodies. Pyocyanin not only gives off a blue-green color, it destroys cilia and mucosa cells of the respiratory tract. Who does Pseudomonas affect? Mainly immunocompromised patients, and can cause mild infections in generally healthy people, such as eye infections from wearing contacts too long, ear infections, and skin rashes. What does it cause? Well, it's an opportunistic bacteria, which means it doesn't really get into the host cells without breaking the tissue or being immunocompromised. So, but once it does, it can affect any tissue, any organ of the body. And here are some examples of organs affected and what they cause, signs and symptoms, and how to diagnose it. As you can see here, endocarditis causes fever, heart murmur, can be diagnosed by a positive blood culture. Then you have pneumonia, cystic fibrosis, gastrointestinal tract of the young infants, and you can do a sputum culture to diagnose pneumonia. On the skin, you see eczema gangrenosum, cellulitis and fasciitis. Burn wounds, they have black, eschar, pale, yellow-green discharge, blue-green drainage, have a fruity odor. Systemic manifestations, fever, hypothermia, disorientation, hypotension. It can also infect the vertebral column, and if there are neurological deficits, it might mean that there's spinal cord involvement. Some pictures, examples of the eczema gangrenosum with the black eschar, and here you see the blue-green ring around the foot tissue here. Eye infections can be caused from prolonged contact wear or swimming in contaminated water. Here's an example of a mucopurulent drainage, and there's also a corneal ulcer. And here's an ear with swelling and drainage. Bacteremia, infection in the blood. Here you can see bacteria in with the red blood cells. This is a picture showing you how infection can start in one part of the body and end up becoming in the blood. And here's some signs and symptoms of that. Treatment and management options. First of all, you want to do a sensitivity test to find out what bug is causing the problem. And some strains of Pseudomonas are susceptible to some antibiotics and not others. It's not one drug fits all. Treatment is more successful with combination drug therapy. Single therapy has less ratio. Here's some examples of commonly used antibiotics, and we also have polymyxin B, monobact aminoglycosides, tobramycin, gentamicin, and amikacin. These down here, third and fourth generation, used with other agents as well. Something special about carbapenems, they have a very small molecular structure, which makes them able to penetrate the gram-negative cell walls through these tiny porins, which other antibiotics are too big to fit through. Ciprofloxacin and levofloxacin are oral agents that usually treat UTIs. Special considerations. People that have drug allergies. A lot of people have allergies to antibiotics, plus kidney and liver function, cost and availability. Some of these drugs are expensive. Some of these people might not have insurance or depending on their situation. Up and coming research, they're trying to come up with a vaccine for immunocompromised people to decrease the mortality rates of this infection. Aerosolized tobramycin for cystic fibrosis patients, they just take it through a nebulizer. Black silicon is it has the same structure as dragonfly wings, nanospikes that can mechanically lyse the bacteria through their cell wall. Really cool. They want to start bringing that into hospital equipment. Prevention, practicing proper hand washing, sanitizing equipment, avoiding contaminated bodies of water. Also, when you're prescribed medications, you have to take all of them because you put yourself at risk for recurrent infections.